Thank you for having us here, the West Australian delegation in Hyderabad. This is my first official visit to India and to Telangana. I'm very pleased to have the opportunity to introduce the West Australian delegation and, of course, make new connections in this thriving biotech ecosystem. I'll run through a few speaking points and then I'm very happy to open and take questions. It was an honour to attend and deliver the keynote speech for BioAsia 2024 alongside the Honourable Chief Minister of Telangana, the Honourable Minister for IT and Industries, and yesterday I had the great honour and pleasure of meeting with the Health Minister for Telangana. And I have remarked throughout this trip how impressive it is to see the leadership in the health system and in the health and life sciences sector. This is reflected in the global trust that is being placed in this region and is evidenced by the excellent partnerships that the state government has leveraged certainly for the private sector, and we have many hopes for a government-to-government relationship. During this visit, I've also had the opportunity, and my delegates have had the opportunity to engage with TomCom for a health skilling symposium. And this gave us the opportunity to meet with officials from Telangana's impressive health and life sciences ecosystem. We're very eager to discuss recruitment of healthcare talent from Telangana, Western Australia, as we cultivate our own health and medical life sciences sector and seek to grow our medical workforce. And through the symposium, we were able to understand Telangana's employment market, education and training opportunities for skilled workers, and the students that are looking forward to relocating from India to Western Australia. During the visit, I'm also delighted to witness the signing of a collaboration agreement between the Edith Cowan University and Charcos Global aimed at facilitating the education and migration of nurses. The partnership will facilitate supporting Indian nurses through transition courses at ECU, including the award-winning International Graduate Adaptation Programme. ECU will also partner with Charcos Global to accredit specialist postgraduate courses for nurses in India working in paediatrics, mental health and oncology. I was also able to visit Rainbow Hospital and Nizam's Institute for Medical Sciences, which has given us a better understanding of the health system in Telangana. The West Australian Government has been embarking on a targeted approach at attracting investment and growing trade opportunities that will enable the West Australian industry to become smarter, more sustainable and more diversified. We have a $410 billion economy. Our interest is in growing industries to diversify this economy and include support for key industries. Most prominent among these is the health and medical life sciences sector. With 1/3 of Australia's land mass, our healthcare system spans the largest geographical jurisdiction on the planet, and we deliver healthcare in some of the harshest and most remote conditions. We recognise the importance of activities that will improve the value and productivity across multiple sectors of the external-facing economy. With respect to health and medical life sciences, our goal is to leverage investments in our world-class hospitals, medical research institutes and universities. And although we have a small population relative to our size and other Australian states, Western Australia punches above its weight when it comes to health and medical life sciences. 30% of the state's budget is spent on West Australia's healthcare system. And as we are well aware, COVID-19 highlighted the importance of innovative healthcare solutions. It made us aware of the importance of building sovereign capability in securing local and global health and medical supply chains so that ourselves and our partners are resilient in the face of supply chain disruptions and global healthcare challenges. One key action for the West Australian Government has taken is the establishment of the Future Health Research and Innovation Fund in 2020. This sovereign wealth fund, built up from the success of our iron ore exports, currently stands at 1.8 billion Australian dollars. It provides a secure source of funding to drive health and medical research in Western Australia, delivering innovation and commercialisation outcomes. This fund has already made investments in Western Australia has a world-class, vibrant innovation ecosystem underpinned by leading research institutions, globally competitive manufacturing capability and a highly skilled workforce. In order to support this ecosystem, the West Australian Government established the Skilled Migrant Job Connect. This program supports skilled migrants with funding and free settlement services, including mentoring and cultural training, to help them establish their lives in Western Australia and participate in Western Australia's workforce. Of all of the drugs developed through Australian university sectors that have achieved FDA approval, a third are from West Australia. Currently, Western Australia has 21 medical research institutes, 244 companies and 24,000 employees in the research sector alone. West Australia has strong capabilities in omics, rare diseases, data analytics, artificial intelligence, predictive diagnostics, access to longitudinal and cross-sectional health data, data linkage capacity to connect and extract data, clinical trials and autonomous and remote operations, robotics and system integration. Western Australia is looking for skilled and experienced health professionals to strengthen our state's health workforce. Experienced professionals in nursing and midwifery, medical, allied health and dentistry are being sought to support our workforce across both public and private sector. And we are already home to some of the world's leading researchers and innovators, and over the next decade we will see some amazing advances in homegrown research and innovation. I'm here today proudly leading a delegation of healthcare providers, digital health biotech companies from Western Australia, and we're here to strengthen our ties from supply chain through to mutual trust and leverage our federal government's robust bilateral relationship. I think there are mutual benefits to be gained from collaboration in this space as India and West Australia look towards similar economic and health objectives. We have had a strong presence with India for 27 years now, with 2 offices, one in Mumbai and one in Chennai, and we encourage stakeholders and businesses in India to connect with our offices to further your engagement with West Australian Government and businesses. And I thank you for your interest today, and I'm very happy to take questions. It is different. So I brought with me on the delegation the 3 main nursing universities, and the ECU partnership that was announced with Chartcross is essentially a skilling to Australian standards, so that they will meet the requirements for entry for Australia. And that is, I think, opportunity for all of the universities to engage with the government as much as private training institutions to provide that extra upskilling of staffing that's required in nursing. One thing that we do offer in Australia, which is in Western Australia, which isn't in India, is specialist nurse training. And that can benefit the community back here, as those nurses can return, work in the healthcare sector here and train the next generation of healthcare providers. We provide specialist nursing in oncology, paediatrics, theatre nursing, ICU. There are so many specialist streams now. And so the focus is an ongoing relationship on how we can support your healthcare sector here in Telangana, but also to support our healthcare sector, and we are in need of around 5,000 healthcare workers up to 2030, at least 5,000. So we are certainly very much looking forward to an ongoing partnership.